The next presentation will be held by Theoni Koukoulaki. And as already said, she's engineering of ergonomist, head of Occupational Safety Center, Hellenic, the Institute for Occupational Health and Safety. And I give you the floor.
Thank you, Wim, very much. I selected a quite provocative title for my presentation. It's high time for a European strategy, for a new strategy. So what I'm going to present today, it's, I will report, hopefully, the key results of this conference. I will stress why you should prioritize us in economic crisis. And I will illustrate why there is a necessity for an ambitious strategy. So what we've heard these 2 days, according to the interventions, we have a radical change in the social policy now in Europe, and some keys are not guaranteed for the future. I would add here that for some countries, some keys are already history. So we know from the European studies that the main drive for us is in EU is fulfillment of legislation. So that is an argument against the deregulation or the smart regulation, or I don't know what new name they're going to invent for that. And the second drive is followed by request of employees and their representatives that stresses the need to have strong trade unions and representatives for health and safety. Also, we've seen that management, commitment, and worker representation are key success factors. Of course, still, micro and small firms need support, because if an accident happens in a small company, that is that a colleague or the employer will be damaged. So the effect is even stronger than it is in a big company. We heard from the European Agency for Occupational Health and Safety, from the Risk Observatory, that we still have coexistence of traditional and emerging risks, new hazards, work organization, and new type of industries like the green industry. We also have combined risk factors. That is, we cannot put priorities over the other. As it was very good said by Jan, we should put all the necessary topics on the agenda. We cannot choose one over the other. According to the 5th European Working Condition Survey that was recently carried out, we also, they confirm the results of the other studies that we still have exposure to traditional risks, to physical risks, and also psychosocial risks. We have a sharp rise of inequalities among groups, worker groups, and among gender. We also have deterioration of work for manual workers and long working hours associated with high work intensity. Also, the Dublin Foundation did an analysis with the existing data they have from previous working condition surveys, and they made a summary of indices like a total quality of work. And we see here a small change across the years. So that means that things have not really improved all of the years. The truth is that Europe is facing major changes and challenges. So let's now reflect on the prevention structures that are there. The most important one is workers' representatives. And we see that economic downturns can weaken trade unions. That is normal because we have unemployment and informal work, so less and less representation of workers. In general, not to mention health and safety. We have a fierce attack on trade union rights. And of course, all this situation undermines the precondition for effective representation, because I must tell you that in Greece we have one of the best legislation for trade union representation for health and safety. We have one representative even for one worker. But if you don't have the resources, you cannot have effective representation. It was mentioned that the role of the representatives should be supported, acknowledged and supported in the new European strategy. Now, regarding the labor inspection, there is clearly a need to have a strong labor inspection. And by strong, I don't mean only having enough labor inspectors to perform inspections. We need to have the appropriate organizational structure, the adequate resources, the expertise, and the employment stability and effective reporting procedures. And also, it is crucial that we put this binding rate in the European strategy, 1 inspector per 10,000 workers, and also other indicators like a target for inspections in the European policy. That, of course, could be specialized in the national policies. Now, we also have heard an example of social dialogue, a sectoral agreement. It was the European Framework Agreement on the Protection of Occupational Health and Safety in the hairdressing sector. It is certainly a positive initiative to promote prevention. However, this should and cannot be used as a legislation alternative or a strategy, as it was heard from the Commission. Now, regarding preventive services, we've seen the example of Belgium. In theory, there is a very positive multidisciplinary approach, but in practice, this approach was not applied, meaning although the competence was there, the companies didn't actually use it. They just use it for dealing with extreme issues like harassment or training. They didn't really use this expertise to make a change, organizational change, or act more on the prevention. Then we addressed the importance of synergy of other EU policies with OSS strategy. Of course, OSS strategy cannot work isolated. It works in close collaboration with other strategies. So we have the standardization policy. We see some contradictions between the legislation on products and the legislation, the social legislation. For example, it was mentioned that in some laws we don't have enough standards, or we have some contradictions between laws, and still we have weak control systems. Also for the social legislation and for the product legislation, market surveillance. So we should highlight synergy between social and product legislation with sectoral studies and also with feedback studies that connect the user with the manufacturer. We had a very interesting presentation on EU strategy on endocrine disruptors. We have seen how a policy that started from environment and then went to public health is not yet reached occupational health and safety, and we should include these issues in a European health and safety strategy because of the type of the toxicological properties of these factors. There's no safe threshold, as we heard, and we have over 100 titles that are affected by these endocrine disruptors, and we have for some sectors like 5 times higher risks. We also heard about nanomaterials and the need to strengthen testing and information requirements in REACH, and also strengthen fundamental research on toxicological properties. Another important EU strategy is that Europe is quite active, is gender equality and OSS. We should take into account gender in working conditions. We should put our gender glasses on, as the speaker said today, because we need more gender-based data and gender-specific indicators. We have seen this study in France when we had an increase, sharp increase, 180% increase of occupational diseases for women. Also, on the other side, include OSS in gender equality agreements and plans. So regarding aging workforce policy, European Commission is very keen on active aging, but of course this cannot happen without occupational health and safety. We should avoid discrimination, but we should ensure prevention for all, because we cannot have a healthy older worker if he or she are not healthy when they're young. We also heard about psychosocial risks. we heard some new words, karoshi, technostress. It's the inability of disconnect from the work, nomadic workers, and really the need to include the psychosocial risks on the EU strategy. Unfortunately, we have seen that the Commissioner was a bit vague when he was asked to explain what could be the content on this, addressing this issue on an EU strategy. So I will now go to the necessity of prioritizing us during economic crisis. So there are several research theories on recession and occupational accidents. Well, the traditional approach is that during a recession we have occupational accidents are reducing, but it seems that some researchers suggest that this reduction is actually based on underreporting and not on reduced incidents. So they better use fatal accidents that are less influenced by the downturns. Also, working hours is a more critical factor because they influence more and they result to a larger increase of fatal accidents. And we see in time of recession increase of working hours. Also, other researchers argue that in upturns, workers are a scarce resource, so they're in better situation to obtain better working conditions, and the opposite exists for downturns. And of course, we must acknowledge that generally there has been a decrease of occupational accidents that reflects a number of changes, increase of technology, increase of service sector. Now, regarding occupational health, we have seen the studies rising of psychosocial risks and related diseases. We have heard 83 million people are affected by depression, according to the WHO. So depression will be the disease of the future. We cannot undermine that. And of course, we have deterioration of workers' health as regards musculoskeletal disorders, mental health, and cardiovascular diseases during and after this restructuring. And there is really a strong evidence on that, that the so-called survivals may suffer serious health impact. As a result of a recession, we have reduction of resources on occupational health and safety and prevention services that can result in non-control occupational hazardous factor and downgrading of health monitoring. This, in combination with downgrading public health policies, can result in increase of occupational mobility. So to conclude, why prioritize us during economic crisis? Because at first we have deterioration of working conditions due to reduction of resources allocated to us. It's a budget that can easily cut. We have a study in Germany that shows that the economic crisis impacted negatively on interest on us. We have companies that have had a very good OS performance and then they change attitude. At that time, workers accept less favorable conditions in the fear of unemployment. We also have increase of shadow economy and underreporting of accidents and presenteeism, which is working while sick. Also, recession brings very often restructuring in enterprise and the public sector that is linked with deterioration of worker health. And we have increased occupational mobility, which is linked with a subsequent cost to the society. Also, labor inspection, preventive services, and research institutes operate with limited resources. That can have an effect on effectiveness of reporting, of inspection, of documenting health and safety, and giving what we said, the evidence-based policy. Also, the scope of occupational risk is enlarged. We have seen psychosocial risks, and recently we have seen suicides. We had the example of suicide in France, where it took an epidemic dimension. Recently, we had an historic decision of the court where in Greece, where a woman, an attempt of suicide was acknowledged as an occupational accident because it happened after the tremendous pressure of the employer to this employee. And we had a fine of 60,000 euro. So let's see where we are on the European strategy. We have the opinion of the European institutions. The Advisory Committee for Health and Safety voted for a new strategy 1 year already. The European Parliament has adopted a report in favor of the new strategy. The European Commission had an evaluation of the strategy. It is about to be published, as we heard from the Commissioner, in the following weeks. So what was the recommendation to the DG Employment? To develop, according to the preliminary evaluation that is already public, to develop a new strategy to secure OSS benefits. EOS strategy is a driver for development of national strategy. Not having such a strategy gives an opposing policy signal to member states that OSS is a low priority, and the EU strategy does have a symbolic value, as it was stated in the first day, that cannot be undermined. Also, it was suggested to extend the strategy goals to cover occupational diseases and emerging risks. We see here, we heard from the Commissioner that it was very successful, the strategy in addressing legislation. I would say that still there are some gaps regarding the musculoskeletal disorders that are not properly addressed, and psychosocial issues. And finally, OSS is a precondition, as our Commissioner said, for the Europe 2020 strategy target to reach 75% employment, although for the moment we have increase of unemployment. So, go to Europe 2020 strategy, the 3 pillars: smart, sustainable, and inclusive. Here, the notion of sustainability is the ecological one, but we cannot have inclusive if it's we can reduce poverty and increase health problems. So we must redefine sustainability, including social sustainability. And I would give here a definition of sustainable work systems by Doherty. Work intensity refers to the consumption of human resources in work organizations, while the sustainable work systems concept presents a vision for the future competitive organization in which human resources are regenerated and allowed to grow. So why there is a necessity for an ambitious OSS strategy? We have heard by the Commissioner that there is a need to have this public consultation, and we will accept the results. And one of the questions is the necessity for EU strategy. So we must keep our fingers crossed that the statistics would be positive to have an EU strategy. So there is no reason to delay the adaptation of a new EU strategy for health and safety. On the contrary, there are too many reasons to press the procedure for a strategy that will reflect the challenges of our time and safeguard sustainable work systems. Thank you.